Why is it important to recognize tongue tie in newborn? Because the short frenulum fits on the base of the jaw, the base of the mouth, and under the tongue. The more anterior it is, the less the tongue will be able to move. In fact, the tongue tie is evaluated in 3 aspects. The premise is where it fits and where it originates. If this is the mouth and this is the tongue, you can attach in a first place in the middle or anteriorly. If this is the tongue, it can attach posteriorly in the middle or anteriorly. The more anteriorly it attaches, the worse it is for the tongue, and the worse the baby's suction will be. The second parameter to evaluate is thickness. Obviously, the thicker the lingual frenulum, the worse the movement allowed to the tongue. The third parameter is elasticity. The more elastic, the better it will be for lingual movement. The less elastic, the worse the tongue movement allowed. It is critical to recognize a short lingual frenulum right away, because if it is quite severe, moderate, or severe, the baby will struggle to open its mouth, but especially to have effective nutritious sucking and to extract milk well. In this case, if the frenulum is moderate or severe, it could create breastfeeding problems such as pain, ragadis, or especially also problems in the baby's growth, where the baby does not grow enough because it does not stimulate the breast sufficiently during sucking, and as a result then the mother may be forced to give formula additions or to discontinue and compromise breastfeeding. In this video, I showed you how to go and assess by lifting the tongue, the short lingual frenulum, to see where it originates on the base of the mouth and where it fits on the tongue. Also take a good look at the thickness and elasticity of the frenulum. Keep in mind that in addition to the infant's tongue tie, there could be sucking problems caused by contractures at the level of the muscles of the mouth, masseter, temporalis, tongue base, and neck, which can be there even when there is no short frenulum. When there are contractures at the level of the mouth, the child opens the mouth poorly and has deficit sucking. So when assessing the child's suction, just put a finger in the child's mouth from the first days of life. Assess both whether there is a short lingual frenulum, but also whether there are contractures or limitations at the level of the mouth that limit the opening and create pain and problems with suction. In 95–97% of cases, the problem is not tongue tie, but rather contractures at the level of the mouth, tongue, and neck, which are easily solved with osteopathic treatments. See you in the next video.